Dear participants, good afternoon. I'm very happy to welcome everybody. Just a second, I'll share the slides that will help us during today's meeting. So welcome to another webinar. This is the last one in the series of webinars on volunteering in the field of palliative care. This series is called The Fourth Wheel. We've already conducted 4 webinars, and this is the last one, the 5th one. So we'll talk about the course results and participant support. So we'll wait for a little bit longer for participants to join, but I'll start with some technical details, how we will communicate and work today. So traditionally, as you probably know, we hold our webinar in 2 languages, English and Russian. So to choose the language of your preference, please find the globe button at the bottom of your screen. There is the button Interpretation, and please just choose the track that you find the most convenient to listen in. So this series of webinars, The Fourth Wheel, is supported by the Grace Trust, and we are very thankful to our UK partner for attention to this important topic, as well as for the financial support. It wouldn't be possible without the Grace Trust. So, dear colleagues, thank you very much for supporting us in this respect. A couple of words about PACE Foundation. In case you don't know a lot about us, my name is Roman. I'm the head of PACE Foundation. Today I have my colleague Felix Pinto Bakirista. He'll be helping me to hold this webinar. So the PACE Foundation was established in 2017 in the UK to support education in the field of palliative care in the Central Asia, the Caucasus countries, Eastern Europe, and the Baltic countries. And we also support professional development of people that work in the field of palliative care across all the countries of our presence. And of course, we always take into account the demands coming from the professional community. So please be active within our discussion, within our webinars. Your questions and ideas are very, very welcome. So today we'll try, depending on how many participants will join us, we'll try to work for 1.5 hours. And so please use the chat to ask your questions, to give your comments. And also, actually, it seems that we are quite a small group today. And you can also unmute yourselves and ask your questions or give comments with a voice. You can do this both in English or in Russian. And I'm very happy to introduce our expert from Romania today, Luana Munteanu. Luana is joining us for not the first time. It's our friend, it's our expert. Luana, thank you very much for being with us today. So she represents the Hospice Casa Aspirante in Romania. She's working and coordinating the volunteering service, and Luana has very extensive experience in volunteering and coordination of this field. Luana, thank you very much again for being with us today. So I guess that was the main general information. We also have 2 simultaneous interpreters supporting us today. Our names are Anna Akmaeva and Maxim Sirenko. Colleagues, thank you for being with us today. And today, actually, we are drawing some conclusions following our 4 previous webinars. We discussed volunteering service and palliative care from different aspects. We discussed how one can organize it, what can be the challenges, etc. And so today we'll try to give another impetus to our participants to continue this track and to develop some ideas locally. And so Luana Munteanu, the expert from Romania, will help us today. So Luana, over to you. The floor is yours.
Hello, everyone. I am really excited and grateful to be joining you again for this course and this webinar. My experience in the first session was amazing. I loved it. I felt so welcomed, and I felt like I could share my knowledge and I could share this beautiful field of volunteering, especially in palliative care. Um, I am the volunteer coordinator for Hospice Casa Speranței in Romania. Hospice has started in Romania more than 30 years ago. And we were the first NGO and the first, we started forming the first medical professionals in palliative care in Romania. Because before Hospice Casa Speranței, palliative care was unknown in Romania. Um, so it's really, really important to me to be able to share volunteering in this field because Hospice Casa Speranței started with volunteers. All of the doctors and the nurses in hospice were volunteers in the beginning. So we wouldn't be here and we wouldn't exist without the work of volunteers. And this is why it's so important for me to be able to share and to show people how important volunteers are and their work is. So thank you for having me again, and I'm excited to see how today's session goes.
Thank you very much, Luana. So Roman will share the slides now. Just a second. Luana, thank you very much for your kind words about our first webinar and about our work in general. Thank you, everybody who has joined. We're a small group, but we're still recording the webinar. It's very important because one can see the webinar later. And also, we would like to reflect also with our team and with the participants. We'll see how it goes, and we'll talk about volunteering in general, and we'll talk about our course in particular. Actually, even I have something to share, some news over the last 1 month and a half. Once again, thank you very much for joining, everybody. So let's discuss our first question. What was the most important step for you after the course? Maybe you've already managed to do something. You can just unmute yourselves and use the mic, or you can also text in the chat. Actually, I also have something to share. We discussed it with our team. We have a couple of ideas regarding this, but let's wait a little bit for our participants to text in the chat. So maybe you've already managed to do something, maybe you're thinking about something. So let's see. I'll open the chat just to see if there are any answers. Right, we are waiting for the answers, but also I wanted to mention that if somebody has joined us for the first time today, that's also possible. Maybe you could share what you'd like to do regarding volunteering, what tasks and challenges you face. So you can text it in the chat or just use your mic. Right, thank you, Roman. After this course, we'll also draft some text scripts, text materials. You can also just watch the webinars that we already conducted. So after this webinar, you can just dive deeper into 8 hours of our course if you haven't seen it. Okay, so let me start then. First, what we've done over this past month, now we have this big course on volunteering and we can keep improving it. And I think it's very useful for volunteering in palliative service and also for professionals in this respect. It's a great step for us at PASTE. And also, colleagues, we thought that maybe we could offer some individual consultations to you, might be interesting. Because, well, of course, lectures and workshops are nice, but maybe you'd like to discuss some more more details, and we stand ready to meet with you individually in Zoom to talk, because, well, we just we're talking about some general topics, right? But if you'd like to discuss something individually, then we are ready to meet with you. Maybe you got interested in some of the topics that our speakers presented, and we also are ready to organize it. It's quite a huge step for us regarding volunteering and this track. We've got an answer in the chat. So Ekaterina says that, well, I've got an understanding that despite the challenges, one can organize volunteering work, right? It's possible. So I got some inspiration and knowledge from this course, says Ekaterina in the chat. Right, so to continue on what I was saying, I was mentioning the individual consultations from us or from our speakers if they have this opportunity to give a consultation to you individually. We can discuss it. Right, Moana, will you be ready to have such an individual consultation if any of the colleagues would like to talk to you?
Yes, it sounds amazing to me. I would love to be doing that. So if anyone is interested, I would love to have a consultation with anyone.
Thank you very much. Thank you very much. That's very, very nice. So I guess we can ask Luana, you've been doing this for a long time, right? But where did you learn how to develop the volunteering service, or it was just knowledge through work? And what helped you to believe in volunteers and to work on this?
Thank you for the question. It's a really good question. I've been with Hospice Casa Speranței ever since 2018, I believe, and I did start as a volunteer in the beginning. And I did start because I had a personal experience with a school colleague who got sick, and we lost her, and it was traumatizing to me. So my mom, who was already a volunteer with hospice, told me I should try volunteering for them and with them. Um, this is how my story with Hospice Casa Speranței started. I was a teenager. I was still in high school, and it really helped me grow up, get more mature, and learn a lot of stuff. I have been working for hospice for 3 years almost now. Um, but since Hospice Casa Speranței and the volunteers in hospice have been around for more than 30 years already, the base was already kind of there. We had a base, we had volunteers, dedicated volunteers who have been around for a while already. And I had a manager on this side of volunteering and coordination. And I did learn from my manager for the most part. But my experience as a volunteer before becoming a coordinator meant a lot. And I think without that experience, I wouldn't have been able to do this job, because it helped me understand how things are seen from the perspective of a volunteer, how seeing the hospice patients is for the first time, and how it is to kind of work with yourself to know how to engage with the patients and how to dedicate yourself to this kind of NGO and this kind of work.
Thank you very much, Luana, for sharing this story. And so if I understand it correctly, you didn't get any like formal training, right? First, it's your personal experience and also support by your colleagues, right? Plus the base, the platform that you already got in the Hospice Casa Aspirante. So I guess that's one of the scenarios how one can develop and grow volunteering services, right? If we talk about a hospice like yours. Now, I'd like to ask our doctor from Switzerland. I think you've been with us for a couple of times. So, Dr. Ivy, thank you very much for joining us. I guess it's difficult to surprise you, right? Because you've already worked a lot in the field of volunteering. But what conclusions did you draw after our webinars about volunteering? Over to you.
Hello, everybody. Hello, Tinara, my friend in Kyrgyzstan, who's following. Yeah, I'm surprised. First, I've no direct. I'm a retired family doctor in Switzerland, and I was involved in the palliative care revolution from the start in the 1980s. So it has changed my work and even my personal life towards question of life and death. Palliative care have been very important for me. I know direct experience on volunteering because I was acting as a professional, as a doctor, working with nurses. And there is a few hospitals in Geneva, and there is a hospice held by volunteers. And I can see different type of volunteering, from having a little place, a little room given by the hospitals to those foreigners, to a hospice really led by volunteers. And it's very interesting to see the difference at the level of involvement. Sometimes you are just accepted just to come and have a little look. And sometimes in the hospice I am talking about, La Maison de Tara in Geneva, it's they are really running the hospice. And they have a very, very good training, and the training is now recognized by the administration, the cantonal, the oblast administration. And our feeling that those people who are trained become very good in the society for helping their families, their neighbors, and so on. What we call in French les proches aidants, the helping neighbors or helping next of kin. So now I didn't follow all the sessions. I followed a few of them, and I was mostly I'm here like an observer rather than an actor, in fact. So I don't know if you have any question about this, but that's what I can say about volunteering.
Thank you very much. Thank you for these examples from Switzerland. I think we don't have a lot of cases around the world, right? Because sometimes we really don't see the volunteering support being in the center, but you mentioned those. And it's very nice that there's a training program in volunteering. And here comes the question, and I would like to actually address this question to everybody, to Luana and to you. So, do you think such educational projects can just be copied from one country to another one, for example, from Switzerland to Kyrgyzstan? Do you think it can work, or the individual differences are so great among countries that we can't just take a course from Switzerland and then just copy it and scale it up in Kyrgyzstan? It's not possible, and it should definitely be adapted to the cultural specificities. What do you think about this? Maybe proceeding from your practice. Roman, I can start then. Yes, Tenaro. Good afternoon. Very happy to see you. Yes, hello everybody. I'm very happy to be here. I'm really happy that we've been cooperating with Dr. Eve for a long time, and we also go to our regions with training programs. We spread the knowledge in the community regarding the novelties that we are getting. I'm a member of the Association of Palliative Care, and I'm also coordinating the work with patients. And Well, of course, it's very important for us to communicate to patients what they have rights to when it comes to pain relief. That's very important for us as well. And the organization of this whole event is very important because we really need to cover doctors, nurses, and I do my best as a volunteer to this respect as well. And I would like to say the following. Last year, I remember the words that the furthest region in our country, we met the head of the service, and she said, well, we offered some training by us, 2-day training, and the head of that region said, well, if only I knew this before, I could save so many more human lives. And of course, we'll do everything, and we will try to involve doctors, nurses, to spread this knowledge, to communicate this to each and every patient, that every patient that needs palliative care can get what we can offer and what we are offering. And we would really like to enable the end of life for every patient with dignity.
I was a volunteer in this association, and I faced also my own issues with healthcare, but with my health. But the palliative care started to be actively introduced in 2012. I joined the movement in 2011, so I was at the beginning of the palliative care because we were circling through the regions. And even in the audience of the doctors, among the doctors, not only just regular people, but the doctors, when we have shown the social show to them, like Life Without Pain was the name, like we need to have the access to morphine and so on. When I was asking the doctors, like, raise your hands, who knows what is palliative care? 12 years ago, not all of the doctors used to know about this, but now, today, we see a very active introduction on our level, in norms, in the regulations, when we are giving morphine also in tablets and in other forms of ready products of painkillers. We introduce this, we train doctors and train patients how to manage pain, and this is very important. And I would say that I am proud that my input here is also present, and of course we will go on with this work. We will support further trainings, and also on the level of the government we will introduce palliative care more broadly, because on the next week we will have a meeting at the Ministry of Healthcare. On the basis of our association, we will enhance use of painkillers on these stages. For each patient who has the need in this palliative care would have access also to the painkillers. And this is also my work. Again, Dr. Ilv, and thank you so much. Dr. Eve, thank you so much with your team also. It was recently, yes. One region knows already how pain management, this is also a science. And in our republic, at every place I outlined this, that only 4 people are certified by WHO in palliative care terms, like to be the doctor in palliative care. And in our maximum, in the audience, in the presence, we say, please do listen to the doctors, to the presenters, please write it down, because you will have to brown it up. Dinara, thank you so much. And now we are switching to the next session, My History. This is the name, My Story. And through Dr. Eves, through Dr. Tinara, we've been speaking about this. A short question also, and perhaps Luana will comment on this. And again, this is the question. Palliative care is something new in Kyrgyzstan. Yes, we understand this. But what about volunteering? Volunteering is more feasible in Kyrgyzstan. Kyrgyz people, do they understand what is volunteering? How they can work on this level? Or this is only a new social wave and it should be backed up further? Here's the answer to this question, whether it is new or not. Officially, we don't have palliative doctors, not even one. Okay, family doctors, yes, they can help, but generally in our republics, I would say we have only 25 beds at the oncology department. I mean palliative care beds, and 5 beds in the south of our republic, where we have more than half of the population. 5 beds. So 30 to 35 beds are addressed for palliative care. And this is, of course, for 7 million people in the republic. This is nothing. We understand this. And recently, Dr. Eve came to us as a guest, and we have shown to him the rehabilitation center for the patients after several states. And there are 20 beds additionally for palliative care. And we are speaking to our people here in the country that yes, we have a rehabilitation center, we have beds, please do direct people to us. And last week, I was at my family doctor. He is the head of the rehabilitation center also. And she told, we have one more rehabilitation center, a good place for the people on the latest stages on oncology. Yes, it was the answer. Yes, we have this kind of patients, but the head of the rehabilitation center did not know that we have this special rehabilitation center, additional new, with the 20 beds. And our work is to raise awareness here as a palliative center. And this is near the biggest cities, but what can we say about the regions of now? The norms and regulations are now introduced. At least we have to have several beds in the rayon, so regional district clinics. Not a department. We understand that this is impossible, but several beds would do. And together with Dr. Eves, we've been in the remote regions, we've had meetings in the clinics. This was the idea. As of now, there is no solution for now, but again, we want to open as many doors as possible, because this is the only way for us to introduce in every rayon, so department, to have several beds, at least, as the beginning, for palliative care unit, because everybody should be treated in a fair way. Dinara, thank you so much for this entry, and this is a very important aspect, by the way. When we speak about the context of the course, we've been speaking about volunteers, like how volunteering department would be here. And you speak about the doctors as volunteers, because as of now, many things are happening on the price of a goodwill, on the price of the input delivered by the doctors and nurses. And again, this is one separate chapter in palliative care, because we know in many countries there are many people who have not enough resources, but palliative care can be delivered not only, but in many things, in many respects, thanks to the enthusiasts, so volunteers and specialists in palliative care. So thank you for raising awareness. This also, please do not stop. And Luana, the question is to you. Luana, yeah, Felix, please. Yeah, Dr. Eve was raising the hand. Perhaps he was initializing this. Yes, Dr. Eve, please. The floor is yours.
It's a privilege for me to know the situation in Switzerland, a Western country where palliative care started in the 80s, and to have met Kyrgyzstan, where the palliative care began for now that, like, I would say 20 years ago, and see the difference. And there is a difference in the society. I'm simplifying, but just imagine Switzerland is an organized country with many doctors, nurses, hospitals, and so on, who normally take care of the people. There are enough doctors and nurses. And the volunteers, they enter by the small door to try to enter this world, this medical world, by the little door, and they try to enter. In Kyrgyzstan, it's different. It's a huge country, it's huge surfaces, and there are many people, and they don't have the help of doctors or nurses. It's difficult to find a doctor and nurses. So the families are supplying, the family are helping each other, and this familial cohesion is something that begins to lack in Western countries. So I would say volunteering could be just the start of something. The palliative care would begin with the families, with the next of kin, helping, and then we look for a nurse or a fellow or somebody who knows a medicine, and you progress towards organized medicine. And here the volunteers is not just something added to the end, it's a beginning. And I think, in my opinion, but from outside, I think that it should be really a start, something very important for developing palliative care. The family, the next, and we have to think about how to support, how to help those families to go on helping. And but for the Western country, there's family cooperation. The family being in the hospital, spending hours with the sick people, it's a good lesson. It's a lesson of humanity. And so it could be another type of start for volunteering.
Thank you so much, Dr. Eve. And this is a very valuable comment because I've heard also many of such stories. You speak here about this compassionate community, which means community filled by the compassion. And this is also a great basis to start with. When we start speaking about the going back to the roots, to the humane relations between neighbors, within a family, with the family members. And I think this is also the compassionate community which can be built on this basis also. And this is also a basis for palliative care support, for volunteering. And perhaps in the West, there would be very important just to look into these ideas, and somewhere perhaps this support would play a huge role, because in some countries this is also a very important thing. Lona, I wanted to switch back to you. As an expert today, could you please comment on the stories of Dr. Yves, Tinara, or your plans perhaps also, because your service is also not putting on hold, you are developing, you have some new plans, ideas, so if you allow, please share it.
Yes, it was really nice to hear how palliative care and volunteering services are going in different countries around Europe. In Romania, despite palliative care being around for around 30 years now with Hospice Casa Speranței, there's still a lot of people who don't know about palliative care, or they just associate it with, I don't know, they just say, oh, it's the place where you go to die, and that's it. It's just the place where you die. And we're fighting really hard to change that perception of people, because a lot of people are scared of whatever happens at hospice because they don't understand what palliative care is. And despite all of that, palliative care is highly necessary in our country at the moment. The cases are rising, and more and more people are in need of palliative care. Um, at the moment, we are raising funds to extend in both Brașov, the town I work in, and in Bucharest, the capital, where we have another hospital. In Bucharest, we're struggling to expand to offer more beds and more space for children in need of palliative care, and in Brașov, we're struggling to expand for adults patients. For us in our country, volunteering has been on the rise. Like, people are more interested in trying volunteering and in actually trying together with their families, which is a trend we have been noticing lately, and we love it. So parents are coming to volunteer with their children and to show them what volunteering means and what caring for people in need means. And to us, that is really impressive, and we love that a lot, because it just tells us that the future generations are going to be a lot more empathetic. They're going to know a lot more about this field of medicine, and they're going to be more inclined to help. And it's really nice to notice. Another really interesting thing I've been noticing, because I worked in Bucharest before I moved to Brasov, and I've seen this type of this difference between the two cities. In Bucharest, being the capital of Romania, and being a really crowded place and people being really on the run all the time, volunteers don't stick around for very long. So they're staying around for around, I don't know, 4 to 5 months, and then they just disappear. They don't come back. They've lost their interest. But in Brasov, where the town is a lot smaller and the community is stronger and people know each other, and I don't know, the pace of the town is a lot different. People stick around for years. We have volunteers who have been around for 20 years, and to me, that is fascinating and it's amazing. I have not seen that in Bucharest at all. So it really does depend from country to country, and even in the country, it depends from city to city and town to town. Um, so regarding what you were saying earlier about adapting courses and knowledge from I don't know, Switzerland to Romania, I think adapting it is necessary, because people in Romania are skeptical about anything, honestly. And they don't open up easily, especially when in a stressful situation and when sick. Uh, and we are the type of people who go to the doctor at the very last moment. So we go to the doctor when the pain becomes unbearable, uh, but we don't visit the doctor to just check, to get our annual check, or I don't know. So courses and information really does need to be adapted for Romanian people, because a lot of changes need to be made in our medical system and in our palliative care system at the moment.
And not only for Romanian people, also for many other countries, you have to translate this somehow, connected to the culture. And I see Felix is also raising a hand, and there is a question perhaps, yeah, a comment perhaps more. At first, thank you so much, dear ladies and gentlemen, for sharing your opinion. It's very interesting. There is a fine line that you raised about the volunteers, doctors, because yes, we are now speaking about how to introduce people into the structure, and there is a painful moment when there is this like a hero doctor who is the first one to do this or that, and who has a pain in the heart, an activist, and this is of course the volunteer. And he is doing this from the bottom of his heart. He is making this as a structures. There are some resources necessary, and of course you have to work on this. And thank you so much, and thank you for Kyrgyzstan to do this. And I think all the hospice that we can take historically, they are built on this principle. The principle is very simple. There is a boy and a girl who has not enough of this or that, and almost all the hospices are having this and the same trait in the story. I want to build it more. I want to deliver more, like in Romania, in British hospice, and where I worked. At first, there is the wish of a person, and then the money will come. Thank you so much. I think there is a problem with my camera, beg your pardon. But that's all from my side. Roman is here. Thank you, Felix. And again, this is supporting the importance of people, because everything which is happening, even in the palliative care, is made by people, for the people. And of course, we see some new institutes. There are some questions related to the organization, to the sustainability of work, to the workflows. And I think you know all these questions. We've done something, yeah, great, but how to make it successful, sustainable, if I may? How to make it in the way which will work after I will be not here, after I will die, for example. I think in this context, volunteering is one of the factors that supports the sustainability of organizations, of governmental bodies, intergovernmental communication, because this is the communal control. And it's very important when we speak about work with different categories of people. And this is a very important resource, also economical resource, what we are speaking about volunteers. Volunteers are saving the resources. Of course, there is a need in resources for volunteers, but I'm pretty sure that there are more input from the volunteers at the end of the day. And I'm pretty sure that volunteering is one of these instruments when we speak about the systemic volunteering, which can support the sustainability of different organizations. And
Luana, I would like to ask you probably now briefly to comment on the following. Obviously, you have the volunteering service, right? And you have people who work there, right? On a payroll, etc. It's professional work, etc. That's very nice. But still, have you assessed how much you spend, for example, to pay for your staff and how much you get from volunteering? Have you ever calculated any economic effect? Or you mostly talk about it, I mean, volunteers from the practical side. They've come to support emotional, etc.
We do have budgets that are established at the beginning of every year, budgets that are dedicated to volunteering and volunteers, budgets that go to courses, workshops dedicated for the volunteers, to transportations for volunteers, and food for volunteers. Um, but we have never tried this kind of calculation or I don't know, comparison between the payrolls and the work volunteers put in. But we we do have volunteers in every single department in our hospice, and we actually think that their help is really important. Like we can't really compare it to anything. Uh, I can't I can't find my words in English.
Thank you for Luana. I asked about this because, you know, sometimes there are some stories that, well, actually, one can calculate, right, how much, for example, uh, hour of volunteer could cost, right? I mean, how many resources you've saved through volunteering, etc. But obviously, there are other indicators and maybe tools that really allow to assess the volunteers' work and economy in this respect. But thank you for sharing what you've already said. So, colleagues, do you have any story, getting back to our question, your story of volunteering that you'd like to share, or we can move on? If you have anything to share, don't be shy. We are all friendly, open here, interested, so please share your stories if you have any. If no stories, then let's move on to our next slide. Now we talk about the importance of small steps. Well, actually, we would like to underline here that if you're even making some very small steps towards the goal that you have, this is very good. It's like a positive reassurance of our work. Okay, let's move on then. Okay, good. Then next, we have such an exercise we'd like to discuss, such a topic that goes as mosaic of challenges. Obviously, we come from different countries, contexts, and types of organizations, but regarding developing of volunteering in palliative care, let's first start with something positive. Let's start with ideas, not challenges. Luana already talked about some plans at the hospice where she works. Maybe you have any other ideas. I mean, what ideas you've got after this series of webinars? What kind of inspiration maybe you've got? And what are your ideas how to develop your volunteering services in your organizations further? I can start, actually, I can start with myself and I can talk about PASTE. So, PASTE is not a typical volunteering organization, right? We are not a hospice, we are more of a like infrastructure organization. And to some extent, it's even more difficult for us to talk about ourselves in connection to, I mean, in comparison to hospices, right? We don't really help patients directly, but we work with hospices indirectly. But still, we are also moving towards volunteering in the field of palliative care within our organization. We do have limited resources, but still, we would really like to help volunteers across very different tracks. Sometimes we have simultaneous interpreters that help us for free, right? Pro bono. Sometimes also designers help us pro bono, etc. And so also now our task is to coordinate volunteering work. And after this course, we also got inspired, actually, including what Luana has presented, quite recently, we adopted a policy how to work with volunteers in PASTE. When we get a volunteer, we also need to understand what are the rules and some practices that this volunteer should follow, right? It's a two-way street for us. Well, of course, it'll be different from volunteers that work in hospice, for example, cas aspirante. Well, we work a little bit differently, right? We work with people that are interested in training and education, but still, we also try to change it inside our organization, inside PASTE, after this series of webinars. And I would actually like to thank once again for all the ideas that we've heard during this series. Dr. If maybe if I may, can I ask you? So you are pensioner, right? But you continue to volunteer and you have some initiatives in the field of palliative care, including in Kyrgyzstan. What inspires you? I do understand that this is your life activity, right? But you wake up every day and you spend your free time on this instead of having a cup of coffee, going to a resort, going on vacation, reading a book. But you develop palliative care in Kyrgyzstan. What inspires you to do this?
Uh, I would say first the fire of palliative care. I think we all know what palliative care is, and we know that we have in common something that, like a mission to explain that the end of life is life. It's not only the obsession of death and dying and so on. So it's you understand, all of you, that a palliative care brings an addition in the quantity and the quality of life. In fact, so this inspires me very much. And I'm not religious. I was brought up Catholic, but I've reviewed the question of faith, but it's a little bit like an religious inspiration, and this is really animating me. I'm 78 now. I have a lot of commitment in life. I'm working for association, not only palliative care. I'm into art and music, receiving musicians home and so on. So no time for just waiting death coming, and it's fun. It's fun. It's really a pleasure to do that. And going to Kyrgyzstan from Switzerland is like an adventure. It's going in the country of Genghis Khan, of Timoland. It looks adventurous, and and having friends there, and now it's a community we have there. So my volunteering to go there is really animated by pleasure and by it's a big word, but love to each other. So it's my type of a compassionate society, but I'm not the feeling that I'm doing something so good for helping people and so on. It's a little bit for my pleasure of living. And I go now to this house in Geneva named La Maison Tara. I see the same, I see the same energy. Pleasure to be together. There is a lot of friendship. There is a lot of joy. Even if people are dying in this house, it's a demonstration to the society that end of life should not be something to cry and to be desperate. It's a hope to go on as long as possible. And I see this house, the Maison Tarave, really animated by this pleasure of being together and to help and do things together. Of course, it's serving, but it's so much pleasure, so much interesting, and it makes people more wise and more useful in the society. So I'm a little bit enthusiastic, but palliative care really give me that kind of enthusiasm, and it's nice to be with you today.
Thank you very much,
But
Dr.
want
Eve.
to add something. I'm speaking of pleasure. Behind this, there must be professionalism. I have to be a good doctor. I have to know the science of medicine. I have to know the pharmacology of the powerful medication we use. This lightness goes with a lot of professionalism behind. But there is not only professionalism is more enjoyable when you add pleasure and love and compassion and that kind of thing. But we have to be professional, and the volunteers have to be professionalized by training. There is a big issue. It's a question of privacy. What are we allowed to say, to share as professionals with the volunteers? And I've seen the two extremes. In the hospital, they are not allowed to hear anything. And in La Maison de Tara, where they share things, they bring information about the patient. So it's maybe it's questionable. There is a question of privacy, and I think this is a big issue. And it's written here, challenges. Yes, it's a challenge. It's a challenge, really. And I want to add about volunteering that in La Maison Tara, some of the people just do the garden. They don't see patients, but they do the garden. Some do the administration. Some do the cooking. It's not only being with a patient, taking care of patient directly. It's part of a social experience.
Thank you very much, Dr. Eve. Of course, professionalism is very important, but I also was going to say before, well, palliative care seems to be a field that is very free of adventures, right? But you mentioned adventures today, and today we have participants from Switzerland, from Romania, from Kyrgyzstan, right? And it's also a kind of adventure for everybody, and also it's an opportunity to meet a lot of enthusiastic, engaged, involved people, and actually that inspires me a lot. I mean, people inspire me mostly. And for me, it's also an opportunity to meet unique people whom I wouldn't have met if I wasn't working in this field. Thank you very much for sharing your thoughts regarding this. Colleagues, Would anybody else like to speak, to share what challenges, ideas? Luana, what about you? Did you have a raised hand?
Yeah. I really enjoyed Dr. Eve's story, and I loved the passion he talks about palliative care with. Um, I'm really passionate about this side of medicine too, and about what we do at hospice. I've been passionate about it for years now, and I can safely say that I want to be doing this for a long time from now on, if not for the rest of my life. I tried working in different environments and in different companies and multinational companies and all kinds of stuff. And I realized after that 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 wasn't my place. That's not where I was meant to be. And I didn't feel happy there because I didn't feel like I was doing anything important or I was helping people. And the best part of my day is when I get the time and the possibility to meet the patients. I love meeting them and being able to talk to them and being able to be there for them. And this is why I work in the volunteering coordination department, because I want to be able to share that experience with other people, and I want to be able to welcome volunteers and show them this path and this side of volunteering that I so much enjoy. And Despite finishing my bachelor's degree in physiotherapy last year, I still decided to work in the volunteer coordination department because I feel like this is my place and where I can offer the best of me and I can give people uh, the the most passion I have. As a challenge, we are facing the same challenge and issue as Dr. Eves previously said, the privacy issues. This is something we have been working on for a while already, and we are really bound on informing volunteers about their rights, but also their obligations in the beginning. So when they sign their contracts and other documents at the beginning, they have to read all this stuff, and they have to know all this stuff, and we make it really important that we inform them about all of this stuff, what they can talk to the patients about, what they can ask, what information they can share outside the hospice, uh, because it's really sensitive information, and the patients are our priority, our uh, as hired people of the hospice, but also for the volunteers. It should be their priority too. So we're working on that too, and we've been working on that for a while now.
Thank you very much, Luana. It's actually especially interesting to hear that, working in palliative care makes you happy. It's not that obvious and evident, right? But it's really nice that this makes you happy. And thank you for raising this topic of privacy. This topic is especially important now in this digital era. We have social media, right? And everything is digitalized and socialized. And thank you for taking care of patients here. Felix, you have a raised hand as well. Do you want to talk about challenges, ideas, or your inspiration? Well, challenges is indeed a very important topic here because when we talk about volunteering and experience in volunteering from different perspectives, of course, it's full of challenges. And thank you for all the participants for confirming that it's a challenge, but also it gives a lot of interest and a lot of passion, right? And well, one of the challenges for me for the future is working with patients at home, right? Like mobile palliative care, because this is the starting point of palliative care. Because when one gets a hospice, then everything is done in the hospice. But actually, this mobile volunteering and palliative assistance, it's a different story. And I would not like to forget about it. Actually, it's a pain point for me because I've been working in this field for a long time and I'd like to do even more. So that's a challenge for the future for me, and also an idea to keep developing it. And about inspiration, I get inspired by colleagues from whom I can learn, get the experience, and combine this all. I guess that would be it for now. Felix, thank you very much. Now, let's move on towards our conclusions. We are a small group today, right? And so I guess that we can step by step wrap it up. And if you have any ideas, any thoughts, please keep them in mind. I'll say a couple of words and then you'll be able to share those. And now we'll send in the chat the information about PASTE, our social media, our website. To be in touch, you can also subscribe for our newsletters and our digest. You can subscribe to our social media. We are represented in a lot of fields. And also, while I'll be giving my conclusion, maybe you could write one thought or one idea. You can write it in the chat or voice it here. Here you can talk about emotion or activity or any idea that you associate with any interesting project in volunteering, and we'll read it together with Felix and comment on it.
Felix writes, love is a great word. We will not translate it. Thank you for teamwork, as Tinara is writing. And we're all a great global team, and it's very important for us to do it together. And we have this feeling of doing this great thing together. Thank you so much for this, for your participation. Dear colleagues, so as at the beginning, as I told, if you need an individual consultation or just to talk about this development of your service, please refer to us. We will try to help you by all the means. We will invite some experts, or perhaps by our own means we will help you to build up volunteering network, volunteering service at your agencies. And should I have any questions, some minor issues, please give it to us, because all of the materials of the course are accessible on our website. Felix, am I right? Yes. Now all the materials are accessible to the participants at the course. We sent it to the email, to the chat. This meeting will be also sent. And of course, in the plans, we will have some more ideas to make a website accessible material with a text. Well, yeah, that's great. We have so many plans, distinguished colleagues, and we will speak about very different topics because we have some more plans related to schools of education for the specialists in 1 month. On the 4th of December, we will have a meeting in Bishkek. Dr. Yves will be there. Dinara, we will see you also. We will speak about palliative care. There will be 3 full days of mentoring, of communication. There will be seminars and so on. And we invite all of you to read our announcements of the final ideas of the year. There will be an annual report for the last year, and we will speak to you, to the colleagues, about the outcomes of your year. This will be in the mid of December, and very soon you will see the announcement from us, the notice. And also there will be a series with webinars. We're planning to start a series of consulting webinars in palliative care, like what is this, what are the associations of palliative care, how to manage this. And we will have the support from Hospice UK, huge structural organization of Great Britain, and we will speak about the umbrella organizations, associations, and of course further on we will deliver on these topics. Further on we will speak about many countries, because many past countries have associations that are formed and they have to be developed. And together with this, we are planning at the beginning of the next year for preparation of the children's seminars, that means support of the children in palliative care. So please do read our social networks. Luana Munteanu, thank you so much. Thank you to Romania. Thank you for your active participation at the series of webinars. Thank you to all of the participants, to the PASTE team. Felix, thank you so much. Dr. Yves, thank you too also. Thank you and goodbye. And again, thank you to the interpreters, Anna Akmaeva and Maxim Serenka. Thank you, colleagues. This was a pleasure. Thank you and goodbye.